So thanks for this invitation. I'm really happy to be here. So today I will present our research project improvement of scaffold cryopreservation by use of magnetic nanoparticles. So I am also from Leibniz University, Hannover, as my colleague is Ben. And we are doing this work also in cooperation with the National University of Colombia. So, as many of you know, magnetic nanoparticles are used in medicine for different applications, such as contrast agents, drug delivery, photothermal therapy, gene delivery, protection from UV radiation, cell imaging, anti-cancer agents or cancer diagnosis, and treatment of bacterial and viral infections. But in this case, we want to use the magnetic nanoparticles to include it in polymerized scaffolds with the aim of use under magnetic stimulation, regeneration of tissues that need electrical and magnetic impulses like vascular tissue, nerves and muscles, and of course, related with cryopreservation, that we can perform the so-called nano-warming treatment for improving the heat transfer during thawing in our scaffolds. So first of all, we take a polymeric solution, polycaprolactone, and we dissolve it in TFE. And after, we include different nanoparticle concentration using two types of magnetic nanoparticles. One were IMP, iron oxide, and the second one was CMP, cobalt iron oxide. We perform ultrasonic dispersion for a period of 3 hours. And after, when we have the solution ready, we proceed to the electrospinning process, as Ben showed you like in the previous presentation. So here we do the electrospinning of the scaffold for 4 hours, and these are the parameters we use for the electrospinning process in order to have a stable process. Once we have the scaffolds, then we perform the characterization, then we do morphology with SEM and EDX for the chemical composition. We also check the magnetic behavior, and finally, we also do cell seeding for checking the biocompatibility and the cryopreservation of the scaffold. Then in relation with the morphology, here is like a reference sample, polycaprolactone. Here we have the morphology of the scaffolds with the different magnetic nanoparticle concentrations. And we found that as soon as we increase the nanoparticles, we have thinner fibers. So like polycaprolactone was 1.2, 1.1 micrometers, and the fibers in the scaffolds with nanoparticles were around 500 nanometers, the fiber diameter. And here we can see a picture of like a big image of how the fibers look like and the particles inside. Of course, we have still some agglomerates there. After with the chemical mapping, then we found that the dispersion of the particles were like somehow uniform in all the scaffolds, as we can see here in the iron. And of course, when we have some agglomerates, then we have higher concentration or more intensity of the iron for the case of the agglomerates. Here you will see like the magnetic attraction of the scaffolds, in this case of the IMP, and in this case of the CMP to the to a normal magnet. We also perform measurements with vibrating sample magnetometry, and but we are still working in this area to improve like the magnetic properties, because right now we have like a ferromagnetic behavior, and we are aiming to have a super paramagnetic behavior in order to stimulate easily the magnetic nanoparticles inside the scaffolds. So then we perform the cell seeding. Here are our scaffolds. These ones are just the reference polycaprolactone, and these ones are with IMP, and these ones with CMP. The color will change as soon as we increase the concentration. Then we take scaffolds, round scaffolds, 1.2 centimeters diameter. We seed them with bone marrow mesenchymal stem cells with 25,000 cells per square centimeter. And after, we check the metabolic activity and the cell adhesion to the scaffold in day 1, 3, and 7 before cryopreservation, and after we perform the cryopreservation. So the results of the metabolic activity show that there is no like a big difference in the metabolic activity for the scaffolds of polycaprolactone in relation with the inclusion of the nanoparticles. However, like the scaffolds with IMP, behave like more similar to the reference than the ones with CMP. We were expecting somehow this one because cobalt can be cytotoxic for the cells, but we are still trying to improve the concentration, the ideal concentration for this type of particles in the scaffold. After we check the cell sealing on the scaffolds, and then you see here the cell adhesion on day 7 for the different types of the scaffolds, and they look like more extended in the scaffolds with the magnetic nanoparticles. And we also prove this with laser scanning microscopy, where we can see that like the cell interaction apparently is better in the scaffolds that contain the magnetic nanoparticles in comparison with just a polycaprolactone. And finally, we perform the cryopreservation in well plate. So we load the scaffolds with 10% DMSO and 0.3 molar sucrose. And after 10 minutes, we remove the cryoprotective solution to perform in-air cryopreservation in the wells. We freeze the scaffolds and 1 Kelvin per minute to -80, and after we store them in a liquid nitrogen vapor phase. And after like 2 weeks, we do the thawing, and we thaw the scaffolds for just in a normal water bath for 15 seconds before continue with the cell sealing. And the results of the metabolic activity after thawing show that like the scaffolds without nanoparticles had better selectivity than the scaffolds with magnetic nanoparticles. But however, we still need to perform experiments under magnetic field, because that will prove if the heating is improving with the presence of the magnetic nanoparticles in the scaffolds. So to conclude, we were able to spin these polycaprolactone scaffolds with magnetic nanoparticles. We also showed that we have better cell and cell scaffold interaction that improve with the magnetic nanoparticles. However, the metabolic activity is no bigger. And we need to use the magnetic field for thawing and also to perform the cell sealing under magnetic field to check the effects of the nanoparticles under this stimulation. Then, thanks a lot for your attention, and I'm really happy to answer your questions.
Thank you.